Many women hear terms like ICU, critical care, high risk anesthesia, and immediately feel anxious. But behind these terms are well trained teams who have one goal, that is, safety of mother during some of the serious medical conditions and their childbirth. Welcome to BirthRight by BirthRight. Hi, I'm Dr. Swapna Samudrala, consultant obstetrician and a gynecologist working at BirthRight, Himayatnagar branch. And today we'll discuss about critical care and anesthesia in high-risk pregnancy. Joining me is Dr. Sunidhara. She is a senior consultant anesthesiologist and critical care specialist who play a crucial role in caring for mothers with serious medical conditions and complex deliveries. Welcome, Dr. Sunidhara.
Thank you, Dr. Swapna, and I'm very happy to be here in this session because this is a very important topic which has to be discussed, and all the public also should know about this.
Many women think that a role of anesthesiologist in delivery is confined to spinals and epidurals. So, what role does anesthesiologist play in high-risk pregnancies beyond labor and delivery?
I would say anesthesiologists have definitely a bigger role rather than dealing with only labor and delivery process. Our role as a perioperative physician and a critical care specialist go even before the mother actually becomes pregnant. So when dealing with complex medical conditions in pregnancy, the patient can be having many medical problems which can be a very high risk when pregnancy happens, or it can push the pregnancy to a state where they land up with problems. So our role actually caters to some problems like bronchial asthma, which is not controlled, diabetes patients where sugars are not controlled, many heart problems where you have to optimize the patient even before she becomes pregnant, and sometimes it may not be even safe for actually the pregnancy to go ahead unchecked. We need to optimize such conditions before pregnancy, and once pregnancy happens, we maneuver their medical condition, optimize their condition, and make sure they have a pleasant journey during the pregnancy, keep both mother as well as baby safe.
So, which pregnancy conditions require critical care support?
Pregnancy as such has to deal with some bodily changes, physiological changes, which has to accommodate two lives, that is a mother as well as the baby. So when medical conditions happen during this critical journey, it pushes the mother and probably puts the baby also at risk. So certain conditions like unchecked high blood pressures, which can cause severe problems with bleeding, or can actually put the kidney, the liver as well as the brain into a very terrible stage. And some conditions like bleeding disorders, or during pregnancy or after pregnancy or during delivery itself, there may be catastrophic bleeding, or there can be some complicating heart diseases which actually have to be managed in a very controlled environment, because the heart is the one which pumps the blood to both the mother and fetus, and when jeopardized, both the lives are at stake. So we need to understand the physiology and how the problem is actually dealt with in pregnancy in order to give them a safe plan. So there are many medical conditions which I have mentioned now, and many more organ wise, like some patients can land up in renal failure where there is no urine output and all the toxic metabolites like the waste products get accumulated. They land up in a condition where we may need to manage them before they come for a delivery process.
When do these women with pre-existing medical condition require ICU level monitoring or care?
So a regular pregnancy without any medical conditions can be managed in a normal observation ward or an obstetric ward, where there are monitoring in place, but probably 2 or 3 patients will be looked after a doctor or a nursing staff. But there are conditions where there is an organ damage, one or more organ damage. Organ means can be the brain, the lung, the heart, liver, kidney, or the blood. If there is any organ damage or the functioning of the organ can be compromised, where the normal physiology or the normal way the body functions becomes damaged, that is when the mother needs more monitoring and more optimization and care and interventions in order to reverse that problem or treat the problem when it actually happens. For example, some conditions such as I've mentioned, hypertensive crisis during pregnancy, or any bleeding problems or hemorrhage which happens where the mother may need excessive blood products for transfusion. There can be some heart issues, or there can be intense clotting in the blood, which actually needs, management in the form of blood thinners and more stringent management in the intensive care unit. Can be done in high dependency unit as well as an intensive care. It all depends on what is the level of care the mother needs, and that is how we go about it.
Sunidhara, how anesthesiologists prepare yourself for such medical emergencies?
Medical emergencies is always better to manage before it happens. As we all know, prevention is always better than cure. It is better to prevent such catastrophes to happen rather than deal with it when it happens. So in order to understand how to manage it, we need some protocols in place and some policies in place. And by rehearsing and revising these protocols and policies, and by doing regular drills, and by trying to do some drills preemptively in order to understand the problem, and when it happens, what is the course of action, what is the flow chart, how we go about it to tackle this situation, really helps a lot. And in order to manage this, we need to anticipate problems before, be a little more proactive, and we need to have systems in place. We need to be ready with all the invasive monitoring, where in the ICU, where blood pressure, heart rate, when the ventilator functioning, when do we require, all these have to be understood before itself and then put into practice.
Can you throw some light on what is this multidisciplinary approach for a medically complicated pregnancy, and how this multidisciplinary approach help us in preparedness outcome of these women?
So when a medical disease happens in pregnancy, which is very critical and it can jeopardize both the lives of the mother as well as the fetus, we need specialists to understand and tackle the problem together. So for example, if the mother is having a heart problem which is complicating the pregnancy per se, and even the pregnancy, the physiological changes or the bodily changes are causing the heart problem to go from moderate to severe, causing issues. That is when all the specialties, including the physician, the cardiologist, obstetrician, neonatologist, and we as anesthesiologists put our heads together, understand why the problem is happening, make sure that the mother is safe. If there is any treatment to be incorporated, take her through the journey of pregnancy and understand when she should have the delivery done, where she should have the delivery done, are our facilities safe enough to have this patient delivered with us, and at the same time how to go about it. So when all the heads of different specialties, the experts, tackle the patient's problem, it becomes easier to navigate, and the mother also will be healthy and the baby also will be healthy.
So are these epidurals and spinals safe for such women or with high risk pregnancies?
For a general delivery, if you ask for labor as well as for normal delivery and cesarean section, we institute a regional anesthesia. That is, we put a needle in the back and try to give regional anesthesia in the form of epidurals and spinals. That is the regular practice. Definitely it is much more safer. When pregnancy happens, there is a difficult airway because of the weight gain. Probably it is difficult to give a general anesthesia, and we make sure that the mother is safe. And another advantage of regional anesthesia is the mother can actually see the baby being born, and that bond actually starts with the delivery process that second itself. So that goes a very long way with breastfeeding, latching, the emotional connect and bonding. So always regional is preferred, but there are certain conditions where general anesthesia may have to be given because of bleeding tendencies, or if there is any low blood pressure, or the patient is come in a septic condition where there is a full-blown infection. These are the conditions where probably general anesthesia would be a preferred choice. Sometimes a mother's heart condition does not allow the spinal or epidural to be given, because with spinal and epidural there can be some amount of sudden drop in the blood pressure or increase in the heart rate, which may not be good for the heart in this particular situation. So in these conditions we opt for general, but more likely the regional practices like spinal and epidural are safer.
What role does this critical care team play in the postpartum recovery of these mothers?
Our role does not end with just the cesarean, or once the delivery has been done, we put in an epidural or spinal for labor analgesia or cesarean section and then it's over. No. So we go beyond the delivery for a few more days or even weeks for that matter, especially in a mother with very critical medical disorder, in many aspects like monitoring of the hemodynamic parameters like blood pressure, heart rate, the oxygen levels, how is the organ functions, is the liver okay, is the liver recovering after the insult is done, is the urine output, the waste products are getting out of the body well or not, is the respiration all right, consciousness is fine or not, is a mother actually mobilizing well after the delivery process is over. So all these things are put in place and monitored at a patient to patient level so that they have enhanced recovery after the delivery process. So that is what we want. We want the mother to be as active as possible and as early as possible so that they can have a normal life and take care of the baby themselves.
Finally, Sunidhara, what message you would like to give for a woman with the pre-existing medical disorders who are navigating through their journey of pregnancy?
So I would like to say that just because you have a severe medical disorder which can complicate pregnancy doesn't mean that you will not have a safe delivery or a cesarean section. The message is come early, identify early, optimize early, and let us analyze and understand how your problem can be catered to and simplified by implementing medications or interventions to take you through the journey of pregnancy as well as delivery to have a safe mother and a safe baby.
Pregnancies with pre-existing medical conditions require more support, more preparedness and more specialists, but they also benefit from some of the advanced care available as of today. At BirthRight, critical care and anesthesia team work hand in hand with the obstetrician along with fetal medicine consultants, neonatologists and physician to ensure safe delivery of mother with pre-existing medical disorders. Follow Birthwipe by BirthRight Rainbow Hospitals for more such informative videos on complex pregnancy disorders.